HIV and weight gain. Why does it happen? That's what we're talking about today on Plus Talk, where we're all about turning positive into a plus. We are celebrating living proudly, happily, and thriving with HIV. And Dr. Celebrate is here. Good to see you, Dr. Celebrate.
Thank you. Thanks for having me.
I read a recent study that reported that 1 in 6 people who start HIV treatment gain at least 10% in body weight over 2 years. I know personally, I have gained weight, and it's a conversation I've had with my doctor, and every time I go in, I have to stand on the scale and I become instantly in a bad mood.
Of course.
But I know I've gained weight, and I'm on, off, up and down, yo-yo, but it is common. Why?
Yeah. So the short answer is the antiretroviral therapy, right? The mechanisms are not clear. However, that is one of the adverse effects of the antiretroviral therapy. We see it more in certain drug classes like the integrase inhibitors and the protease inhibitors. Some of the other ones have a little bit of other side effects like insulin resistance, but weight gain is unfortunately one of the side effects.
I should point out that not everyone gains weight,
Of course.
and the amount of weight varies. But, I would think that good nutrition is a good way to start, right?
Absolutely. So one of the things that we're seeing is because we have so many new advancements in the antiretroviral therapy, and the lifespan is so much more than it used to be in people living with HIV, we're now seeing these chronic diseases, right? So one method of weight gain is the antiretroviral therapy, but the other one is even just people without HIV, the way that they gain weight, overeating, not having enough physical activity, not having good nutrition. So that's one of the reasons why we see weight gain also. And then like you mentioned, the lipodystrophy.
Right. Explain what lipodystrophy is.
Yeah, so now we see more of a mix, right? We see the central obesity and we see lipodystrophy or lipoatrophy on the arms.
And this isn't like jiggly wobbly fat. This is sort of fat around organs and muscles. Have I got that right?
Yeah, so that's visceral fat, and then there's also the central adiposity, which you will see central weight gain, and then a little bit thinner arms and limbs, things like that. So we see that a little bit more as opposed to back then when it was a little bit fat wasting.
Right.
We see a little bit more of a mix now.
So for those of us living with HIV, are there a group of us that are more likely to gain weight than others?
I think it really just varies. There's a lot that goes into weight gain, like we mentioned earlier. Physical
Stress,
activity.
by the way.
Stress is another big one.
And I know just the physicality. Look, I'm a stress eater. When I'm stressed, my hand goes to food and I'm not even paying attention.
Me too.
The other day, I went through an entire packet of gummy bears in about 2 seconds, and it was because I was really stressed, and it wasn't until I was like, and I hadn't done this in a while, and I was like, and I wasn't hungry, there was none of that, it was just stress. But stress eating aside, stress itself can cause weight gain, can't it?
Yes, because of the physiologic effect of stress on your body, the increased cortisol levels. It's a stress response.
So what are the long-term consequences for weight gain, specifically for people living with HIV?
Yeah, so when you are controlled, HIV controlled, your viral load is suppressed.
Undetectable.
Really, you have the same type of effects as anyone without HIV. So that means that you can take all of the necessary precautions to kind of prevent and lose weight, as well as if you have diabetes or insulin resistance, you can be on the other weight loss regimens.
Okay, and I'm going to get to those in a minute. What would you say is like a healthy diet? Is there a magic bullet healthy diet plan for people living with HIV?
There's no magic diet for anyone,
Anybody.
right?
Right.
Yeah, I wish there was. There isn't. But obviously when someone is a little bit more overweight, and people living with HIV, they do have an increased propensity for heart attack and stroke, also because of the antiretroviral therapy. Those risks are there.
Yeah.
So I think it's a really important conversation to have with your physician to kind of prevent these downstream things like high cholesterol, obesity, diabetes, high blood pressure. Those are all really big things to kind of tackle before they're a problem.
And I think as the population of us living with HIV is getting older, thankfully, we're living longer, there are the comorbidities that come with also just getting older
Yeah.
on top of having
Yes.
living with HIV, right?
Yes, of course. Especially we see it muscle wasting. That is something that's prevalent as you get older. A lot of us don't really have great protein intake. I'm a huge advocate for more protein in the diet. And then also physical activity, weight training to keep your bones healthy.
Yeah.
Bone density is a big thing.
Really important. What about foods that we should avoid? Is there anything, if you're living with HIV, that you should go, look, that is just something you shouldn't be eating?
I would say because HIV can sometimes be complex and you can have liver issues as well, liver cirrhosis, things like avoiding shellfish, things like that are things that you should avoid.
Okay. I know that there are certain foods that have negative interactions with HIV meds too.
Yes, that's a big thing. I know the wave of going more natural and herbal is kind of the thing and trendy, but I always say a lot of these aren't studied, and there are huge drug-drug interactions with a lot of the herbal things.
Yeah, I learned just recently that the drug I'm on doesn't play well with certain things that can be in a daily men's multivitamin pill. And I only just discovered that maybe a couple of weeks ago.
Yes.
And my pharmacist pointed out and said, you should take your multivitamin then and give it at least this long before you take your meds.
Yeah. And I'm glad you brought up the multivitamin, because what I often say is the supplement industry, they really prey on all of us wanting to be healthier.
Sure.
And recent studies have shown people living with HIV, there are certain micronutrients that can be beneficial. Zinc and selenium, they play an important role in immune function.
Okay.
But what they found was that for people living with HIV, when they were tested for their zinc levels, if they were deficient in their zinc levels, and they took 12 to 15 milligrams of zinc for 18 months per this study, they had an improvement in their CD4 count. But if they weren't zinc deficient and they took zinc, it didn't really have any improvement.
Interesting.
Yeah.
So again, it just highlights how important having these conversations with your healthcare provider are.
Of course.
And what about working with like a nutritionist?
Yeah.
Is that something that if you have the means to or the access to is advisable?
Absolutely, yes. And I would say even for people not living with HIV, right? I think this is an important part of healthcare.
Yeah.
Your overall well-being.
Now you touched on this a minute ago about diabetic and weight loss.
Yeah.
GLP-1s. They are everyone's clamoring for their GLP-1s or weight loss drugs. We hear a lot about them. Are they safe for people living with HIV?
Yes, they are. And we often use them still. They're second-line anti-diabetic agent if you have type 2 diabetes. We can also use them for weight loss. So kind of what I was talking about earlier is we want to prevent any of these downstream chronic effects.
Heart disease.
Stroke, fatty liver. That's something else that we see a lot because of these antiretroviral therapies. So really getting a tackle on all these things before they cause a problem.
Yeah. What about the importance of sleep and exercise?
Yes. So lifestyle medicine is also one of my other specialties, and it rests on 6 different pillars. Restorative sleep is one of them, diet, exercise, stress management, positive social interactions, and obviously avoiding risky behavior like avoiding alcohol, drugs, smoking. All of that really plays a role in your immunity and your overall health.
Yeah, well, Dr. Celebrate, this has been really interesting. I guess bottom line is, look, it is potentially a side effect that if you're living with HIV and you're on treatment, which is fantastic, that makes you undetectable, you might gain a little bit of weight.
Yeah.
But you can manage that and control that through diet, exercise, trying not to stress as much, and some good sleep.
Absolutely, and I'm not saying that you shouldn't be on antiretroviral.
No, absolutely not. No. No
Yes.
one is making that statement. We're all about it.
Yeah.
Dr. Celebrate. Thank you for
you
coming
so
in. I really
much.
appreciate it.
Thank you for having me.
Of course. That is going to do it for this episode of Plus Talk. If you want more information about what we've discussed, check out the website, pluslifemedia.com. And remember, you can like, follow, and share. We are across all your favorite social platforms at Plus Life Media. Until next time, eat something healthy. Maybe don't have as many glasses of wine. Who knows? We'll see you next time. Bye-bye.